Hi, I'm Dr. Eric Janowitz, and today I'm going to talk to you about exercises to avoid to prevent back pain. Now, a lot of my patients ask me, hey doc, what exercises should I do or not do now that I'm under chiropractic care? The first thing you need to know is a little bit about the spine, the nerve system. So your spine has two purposes. Number one, it's going to support you. Number two, it's going to protect you. It's going to protect those nerves. So from front to back, obviously the spine should be nice and straight. But from the side, you should have three curves: a forward curve in your neck, a backwards curve in your mid-back, and then a forward curve in your low back. And the reason why we have these curves is they act as a shock absorber to allow us to handle the forces of gravity. Now, when you exercise, you are actually increasing the forces of gravity because you're increasing the load on the muscles. So the first thing you want to realize is that if your body is in a bad position and you add more muscle tension to those areas, you are going to be prone to inflaming and injuring the nerves in your body and causing more damage in your attempt to do more good. So the first thing you want to do is make sure your body is in a more optimal position. So always exercise tip number one is make sure that you're strengthening your body with good posture. You shouldn't be leaning over, slouching, bending over, twisting. You want to make sure your body is in good structural alignment when you're doing that movement pattern. Now, there are some very common exercises that, if fine-tuned, can make a big difference in the quality of your exercise program, but also can help you prevent back problems. The first concept you want to realize is axial compressive loading is very bad for your body, and that is where you apply some sort of a force down onto the spine, which can damage those joints and those ligaments, discs, and nerves. And so the most common thing, I know, you're going to give me brief on this. I know you squatters like to do this, but squatting, bar squats, not good for you, because when you do that, you're going to have to bring your head forward to be able to put the bar where it needs to be. That alone, pushing your head forward, is not good for your body. You do enough of that at your desk and using your cell phones, but in doing this, you're pushing your head forward, but then you're putting the bar and all the weight compressing your spine. That is one of the worst exercises that you can do for your back. The second thing you want to realize then is, well, what do you do? Well, you can go ahead and do lunges. If you carry barbells in your hands and do lunges, you can keep your posture in a very good alignment, and you'll be able to engage the muscles of your back and your glutes and your legs very effectively while minimizing damage to your spine. The next thing you want to realize is that overhead presses are very compressing to the body as well. So a shoulder press pushing up is when pushing the force down into your body. So one thing you can do if you're doing an overhead press is then do it with a very low weight and a higher repetition to avoid that extra stress in your body. The other one you want to realize is calves. It's a very common exercise that you do, and calves are great, and they're oftentimes neglected, by the way. And so in doing calves, you want to do them in a seated position or a standing position. The bad standing position is when you use a standing squat machine where you go under the bar and you're lifting the weight through your spine and through your shoulders. That weight is compressing there. So you want to do your straight leg squats by being in a leg press machine where your leg can be straight and you're bending with your toes while keeping your leg straight, but you're protecting your spine and your nerve system. The other thing you want to realize is that jump training or plyometrics can also be very compressive to your body. So when you're jumping up and down, that force is going through your body. And if you have a disc problem, that could be causing a lot of damage. So another thing you might want to avoid is a lot of running. So runners can develop a lot of disc problems if their body's in poor position too. So maybe switching to like an elliptical or trying a exercise bike can make a big difference as well. So here are a couple tips that you want to do. The last tip I want to share with you is if you're feeling a sharp pain while you're doing your movement pattern, know the difference between a sharp pain and versus an ache by just working out and using the muscle. If you have a sharp pain, make sure you stop, and also try to do things like a higher repetition, lower weight versus a higher weight where you can only do a few of them, because then you'll tend to compensate or you'll tend to torque yourself, and that's where a lot of damage occurs to the body. So I'm Dr. Eric Janowitz. I hope this information was valuable to you. If it is, please make sure that you like, subscribe, ring the bell, share, whatever it takes to get this information out to the people you care about. Thank you.